have returned with another interesting episode to discuss a vital health issue that lays claim to the lives of so many people, majorly due to lack of knowledge. For instance, 20% of women do have bleeding in pregnancy. Sometimes it could be a sign of something serious. Sometimes there may not be much to worry about. And that's why we thought it wise to discuss so that we can be well informed. Thanks for joining us on this week's edition of Seeking Solutions on NTA Enugu Network Center as we discuss bleeding in pregnancy. I am Minna. Our guest doctor today is a consultant obstetrician and gynecologist, Dr. Onyekba Ifeanyi. It's good to welcome you to Seeking Solutions today, Doc.
Thank you.
All right, let's start with sharing some of your encounters with women bleeding while in pregnancy.
Thank you. For obstetrician and gynecologist, bleeding in pregnancy is an emergency. And so anybody who is an obstetrician must have experiences of bleeding in pregnancy. There was this woman that walked into the hospital on her legs and suddenly she collapsed. And that's not an emergency. Everybody was, what is the problem? There was no obvious bleeding apart from some stents on her lunges. But before you know, this woman was unconscious, gasping. And then when we rushed in, we checked and checked the vitals. And with few tests, we were able to identify that she was pregnant just about 6 weeks or so. And without wasting time, we knew it was a bleeding. But that bleeding was inside the abdomen, what we call ruptured ectopic pregnancy. And from that point to the theater, because if you don't do it now, you're down in a few minutes time. So it cannot come in that form without any obvious bleeding here. Then you can have a woman who is pregnant, maybe walking around in the market or doing her chores, only to bend down and see that everywhere is blood, without pain, without anything. It can also lead to death of both the baby and the woman. So for us, no bleeding in pregnancy is normal, no is acceptable, but the degree of fatality may not be the same.
So let's now look into possible causes of bleeding in pregnancy.
Alright, bleeding in pregnancy can be grouped into two. We have the bleeding in the early pregnancy and we have the bleeding in the advanced pregnancy. In the early pregnancy for us, when we say pregnancy is early, it means it has reached the advanced, it has reached the age of capacity of the baby to survive outside the uterus. That's the age of viability, which for us is 28 weeks. But everybody in the world or in the advanced world is 24 weeks. So any bleeding before 28 weeks in our environment is related to miscarriages or abortion. Then any bleeding beyond 24 weeks could be due to other causes. Now, if you are bleeding in early pregnancy, it will be due to miscarriage, which could be complete or incomplete. It could be due to ectopic pregnancy that has ruptured. So these are the major causes of bleeding early in pregnancy. Then in the advanced pregnancy, it could be due to placenta previa, it could be due to placenta abruption. In previa means that the placenta is lying in front of the baby, covering the birth canal or the mouth of the uterus. So you can have abruption placenta, where the placenta has suddenly detached from the uterine wall before the delivery of the baby. So it could also be due to vasa previa, where you have one of the blood vessels that supply the placenta passing in front of the mouth of the uterus and can rupture, and it then begins to bleed. Of course, everyone who has other trauma like accidents, whatever can bleed, but these are the major obstetric causes.
Okay, Doc, is it possible that the placenta can on its own just move when there is no pressure? I mean, it just stays and moves to cause bleeding.
Well, the word moves, but not the literal. So the word is moving. When you have a placenta previa, it means that the placenta is lying in the lower part of the uterus. And then it's possible that during the development of the uterus of the pregnancy, by the time the uterus is blown up, that placenta may move up with the uterus. In that case, we say it has migrated, but normally it doesn't necessarily move. Then, if it doesn't migrate, that's where the problem is. It begins to cause bleeding. Or the placenta just detach from the attachment. And when it detaches, of course, the placenta is almost 80% blood. So when it detaches, start having bleeding both from the baby, from the mother, and then causing the problem.
Okay, let's look at the ectopic pregnancy that we talked about. What could suddenly rupture the fallopian tube to cause bleeding?
Ectopic pregnancy simply put means development of pregnancy anywhere outside the endometrial cavity. Endometrial cavity is the inside of the womb, the womb where the baby is supposed to develop. But in ectopic pregnancy, 95% of the time it develops in the tubes. The tubes are like the arms of the uterus where they pick the egg and pick this, and the sperm and the egg live there. So if the tube for one reason is narrowed, the pipe is narrowed, the sperm can pass, leave the egg, form the fetus, but the size cannot pass back to enter the cavity. So the baby starts developing in the tube. And of course, so the tube is not meant for carrying the baby. It's a narrow, can be longer than my finger. So when the baby starts growing, the only thing remaining is for the tube to burst. And when it bursts, the whole uterus and the tubes have a high vascular supply, high blood supply. So once it ruptures, the woman starts bleeding. But the danger is that it doesn't bleed out. So you don't necessarily see blood pouring out. The woman will start feeling dizzy, feeling weak, faint, and then possibly die. So, and in pregnancy, the amount of blood that flows through the uterus is so much, up to 700 milliliters of blood per minute. Can you imagine? I will have about 5.6 liters of blood in our blood body. So when you have close to 1 liter flowing in 1 minute and it's open, that's why it's dangerous. So within 30 minutes to 1 hour, if nothing is done, the woman can die.
Okay, Doc, let's look at other, vital symptoms, other symptoms that could occur, like you just mentioned, bleeding in women while pregnant. Some of the bleeding might not physically
concealed.
Yes. So what are the other signs that a woman should possibly see and know that she's bleeding?
Alright, the first sign is to see blood, which everybody knows. When you see blood coming out from your private part and you're pregnant, it is bleeding in pregnancy. The other things that may happen, and you may suspect bleeding, is that you start feeling pain. Some of the causes of bleeding can cause pain, like miscarriage, like ruptured ectopic pregnancy, like abruptio placenta. They can give pain in the abdomen, and then you may have spotting on your undies. And then, as the pain is there, you may start becoming weak. The Bible says that blood, the life of an animal is in the blood, and the science also agrees with it. So when you are losing the blood, you start feeling weak. From feeling weak, you start feeling dizzy. From dizzy to fainting, you have fainting attack. You can the patient may go unconscious and may die.
It's terrible. Okay, but let's look at the level. At what level should a woman bleed in pregnancy, and you begin to really worry that something is actually wrong?
Alright, as I said earlier, bleeding in pregnancy is not normal, no matter the quantity, no matter the time of the pregnancy. For us, some people will come and say, I am seeing my period when I'm pregnant. We say, no, it's not true. If you are having any form of bleeding while you are pregnant, the bleeding has to be assessed, the condition has to be assessed by the doctor, and then diagnosis made, and then possible management if need be. Don't ever sit at home when you are pregnant and you see, even if it's a spot on your pant, it is not normal. And however, when you are bleeding to the extent that you are becoming dizzy, weak, or the quantity of blood, you can see the blood pouring away. In short, hire the next available, even if your enemy's keke, enter it and rush to the hospital. Okay. There is no small bleeding. Just like I explained, you may have a spot, while inside you have lost liters of blood. And then if somebody will say, don't worry, it's just a small thing. It's in that small thing that person may die. I've opened up a woman and I've evacuated close to 2.5 liters of blood inside. But that woman wasn't pouring due to ruptured ectopic pregnancy. It's a dangerous thing to bleed in pregnancy. But two lives are involved here. The life of the mother and the life of the baby.
Okay. Apart from the pregnancy itself, could other underlying ailments that is not pregnancy, cause a woman to bleed even when she's pregnant?
Well, just like any other woman can bleed. A pregnant woman does not mean you are not a woman again. So any other thing that can make a woman bleed can make you bleed. If you have cancer of the cervix, of the vagina, of the vulva, or have trauma, even sexual trauma, if you have sudden penetration of penetrative sex, whether you're pregnant or not, you're bound to bleed, or at least spot. So whatever that can make any woman to bleed can make a pregnant woman also bleed. But the one we're interested in is when that bleeding is somehow related to the pregnancy.
Okay. All right, Doc. Can it be prevented? I mean, can pregnancy, bleeding in pregnancy be prevented?
Wow, prevented? Yes, the only because yes, because we have antenatal care. Antenatal care is supposed to be a preventive medical services. So, some of the causes may be preventable. For instance, if a woman has high blood pressure in pregnancy, one of the complications is detachment of the placenta, which we call abruption placenta. So if that man is assessing antenatal care under a scale better than attendant, and a scale better attendant, I don't want to go into the nitty-gritty of information. Simply means somebody who is trained, who is proficient in managing pregnancy. Could be a qualified nurse, a midwife, a doctor, but they are the top echelon is the gynecologist. So if you are assessing scale there, you'll be able to manage the hypertension, control the blood pressure, and reduce the chances of leading to abruption and bleeding. And again, if a woman has a history of pelvic inflammatory disease, what we call infection, common things, and we're poorly treated, as well in the environment today, a lot of people go to take herbal concussion, go to the chemist, take anything, just, you can have incomplete treatment, and that will lead to occlusion of the tubes. So that when you now get pregnant, you are exposed to high risk of ectopic pregnancy and rupture. So if a woman assesses, if our healthcare seeking behavior is improved, that you seek the right doctor for every ailment, and for instance for infections if there is any, and it's properly treated, you are reducing the risk or the chances of ectopic pregnancy and rupture that will lead to bleeding.
Okay, Doc. Is it possible that what a woman eats while pregnant can affect or cause bleeding in pregnancy? Like say when a woman is pregnant, don't smoke, don't drink alcohol, don't take this, don't take that, don't take that. Is it possible that it can cause bleeding in pregnancy?
Some questions in medicine are not yes or no. On the first place, everybody keep asking, doctor, is there anything I can eat and I should stop eating? It's not all diseases that has to do with you stop or don't stop eating. But then, as I said, it's not a yes or no answer. We found that smoking, for instance, increases the risk of having placenta previa. Another way they say abruption and smoking may also help reduce abruption, which I don't think is true. I know some things are speculative, but we know it can increase the risk of abruption. So if smoking, not necessarily smoking just in pregnancy, smoking, in our environment, they hide smoking or they don't smoke. But overseas they smoke even sometimes more than the males. So a smoker has a risk of having placenta previa. And then placenta previa is a risk factor for bleeding in pregnancy. So the answer, so if you can say stop smoking, there are other benefits that companies are not necessarily bleeding. Nobody will start advising against smoking just because of bleeding that is rare. But smoking, you don't encourage me to smoke. No matter the alcohol, no other food. There's nothing in terms of nutrition that you can say this will lead to bleed the way you are pregnant. So eat your normal food. Okay. But don't take anything to excess.
All right, we are still here discussing bleeding in pregnancy, and Dr. Ifeanyi is very much still in the house. We'll take a short breather now, and we'll be right back to discuss how to cure bleeding in pregnancy. Stay with us. to seeking solutions. Bleeding in pregnancy is our topic of discussion with Dr. Ifai right here. Okay, doctor, let's look at management of bleeding in women with pregnancy.
All right. Management here is also dependent on the cause. There is no one solution for all because it depends on the cause. So maybe we may dwell a lot here, so we'll be able to touch the small places. You remember I said there is early pregnancy bleeding and late pregnancy bleeding. In early pregnancy bleeding, which most of the time has to do with miscarriage or ectopic. If it's miscarriage, what we need to do is to assess the woman and find out is the miscarriage complete or incomplete. Most of the time, if the miscarriage is complete, the bleeding begins to tailor down and fizzles out. But if it's incomplete, the woman continues to bleed until you complete it. It's like the uterus continues to cry until you remove all the problems it has inside. So in that case, the treatment will be to empty the uterus. What they commonly say, wash the uterus, but we don't wash the uterus, we evacuate the uterus. And there are different methods of doing that. We have the surgical method and the medical method. In the surgical method, which is faster, which is more certain, I don't want to use the word better. In that case, we use what we call manual vacuum aspirator. We do MVA, that's MVA. Something that looks like a syringe, that looks like a pump. You introduce it through the vagina into the womb and then pump out whatever is remaining. It works like magic. It has its own problems anyway, but finish it, bleeding stops, everything stops.
Okay.
And the woman goes back the same day, except if she had lost so much blood, in which case you may need to give blood.
Okay.
Now, the other method is to use blood. Related issues. But it is ectopic pregnancy. Because the ectopic pregnancy that is of importance to us is the one that has ruptured. That's the one that will bleed. The one that has not ruptured has its own management options differently. But when ectopic pregnancy is ruptured, the only option at that time is emergency exploratory laparotomy. What does it mean? You have to open up the abdomen, explore. Don't know what explore, you search. Because you may even go in and see it's not even bleeding from the uterus. It may be another thing that is bleeding, but in many cases it's from the ectopic. So you open up, identify the source of the bleeding, stop it. And then most of the time, in short and all of the time, you cut off that tube. That, we have two tubes.
Yeah.
And with one tube, if the other tube is okay, you can still have the number of children you want to have. But sometimes you may have the two tubes cut off. Maybe this will have it. Because we have ectopic today, the risk of ectopic in subsequent pregnancies is high. So wherever you miss your period, you rush to the doctor to confirm that the pregnancy is in the uterus or in the womb, not anywhere else. So for ectopic, it's emergency. You don't wait for anything. So in this type of surgery, you don't even wait for, nobody will say, go and get blood. Make sure that if you wait for blood, the woman will die. So you better go in without blood while they are making plans to first of all stop the source of the bleeding. Okay. I mentioned the quantity of blood that flows through the uterus. If you wait, a minute is as precious as anything. So anybody who is delaying, whether at home or in the hospital, is not doing womankind.
Okay, well, what you're saying in essence is that if you have the history of ectopic pregnancy and you happen to be pregnant early again, you rush to the hospital. Is it possible that that doctors can help make the fetus enter the womb so that the person does not have a repeated ectopic pregnancy?
Okay, I have had, I think it's a fiction because it's only one place I read it, not a scholarly book article anyway, where somebody has claimed that he has been able to remove ectopic pregnancy from the tubes and transfer it into the uterus and it's survived. So I think it's a speculation. Many things start from speculation. Now, but if what we ask you to come early is to be able to identify the ectopic when it has not ruptured, assuming it is a recurrent. Because if it's not ruptured, there are still other management options, either medical management using only drug to destroy the pregnancy in the tube, or even going for surgery, open the place, remove it, and repairing the tube. So the aim is one first thing, conserving that tube so that your fertility will not be jeopardized entirely, and also to avoid the emergency and threat to the life of the woman.
Okay, let's look at cure. How can, you've been mentioning, how you can manage it and all of that. How can you possibly put a final stop to bleeding in pregnancy?
Fine, the bleeding in pregnancy is not a disease, it's a symptom. So you don't have a cure. It's not a cure thing. And if you look at what I have mentioned, there are many. So they cannot be cured for one thing. As I said, if it's related to miscarriages and abortion, the cure is to empty the uterus by whichever method is convenient and available and acceptable to the woman. They say the patient has the right even to die, to say, I don't want to leave me, let me die. So you don't just say, woman, the best thing here, the only thing here is to go and open you up. If you don't open you up, there's nothing again. There are other options, but you have to let the woman understand the pros and cons of all the options, so that if she's saying, I want this, it will be an informed decision. So for such one, evacuate the uterus by whatever means or method that is chosen by both of you. Then if it is for a topic, as I've said, open up, stop the bleeding. Then if it is in advanced cases where you have bleeding due to into play the quantity of blood loss or the quantity of ongoing blood loss, the age of the pregnancy, and even the state of the woman.
Okay, doctor, before I let it go, what would be your advice to women who are still giving birth in order to ensure that they are safe from bleeding while pregnant?
Okay. The prevention of bleeding in pregnancy is not to be pregnant.
Ouch.
Now.
And that's what I said.
So, but then the good thing about it is that we bring the issue of family planning. Family planning helps to reduce, because the more number of pregnancies you are having, the higher the chances you have. If you have just one pregnancy and it's gone, you may not have bleeding in pregnancy, but if you have 20 pregnancies, it means you have 20 risk or 20 chances of bleeding. So we ask women to reduce the number of pregnancies they have or they carry for obvious reasons. At least when you reduce the number of pregnancies, the chances of bleeding in pregnancy in that woman has significantly reduced. Then the other thing is to avoid the causes of early pregnancy losses, like early pregnancy bleeding, like in ectopic, is to first reduce the number of sexual exposures, especially unprotected sexual exposures, which will lead to increased risk of pelvic infections. And it is these pelvic infections, when poorly treated or not treated, can lead to complications of ectopic. So we counsel women to on health education, safe sex or safe sex education, so they know when and what to do. Then if you think you have infection, seek the right help. Go to a gynecologist to treat you, to assess you and treat. Don't go to the quacks. In collective we call them quacks. And then if you become pregnant, please, as early as you can identify that you're pregnant, enroll for antenatal care.
Okay, that's fair enough. Thank you so much, Doctor, for your time on Seeking Solutions today.
You're welcome.
We really appreciate it. Thank you, sir.
You're welcome.
All right, you've heard it all from Dr. Ifeanyi Onyeba. You want to get pregnant? You don't want to bleed while you're pregnant? Please visit the hospital. Have a holistic check of your systems, before you get pregnant, so that you'll be sure that you have less risk of bleeding while pregnant. Well, I'm sure it's been a fruitful day on Seeking Solutions today, so why don't you do it again sometime next week? Until then, enjoy your weekend. Bye-bye.
Jackpot of the week. Place bets and hit